Indiana Attorney General Todd Rokita is suing TikTok. He claims the app misleads users about the type of content it shows kids, the amount of personal information it collects, and how it uses that information. WRTV's Meredith Hackler breaks down what this means.
TikTok's slogan is to make every second count. But in a new court filing by Attorney General Todd Rokita, he's claiming that those seconds are misleading users. In that complaint filed Wednesday, the Attorney General claims the app says it is appropriate for users aged 13 and older. However, he says that it contains salacious and inappropriate content. It goes on to say that the app suggests things that are inappropriate to children simply by typing a few letters. When I tried this on my phone, some of those results came up, while others didn't. It also cites incidents that happened at a Fort Wayne high school, which were believed to be social media challenges that stemmed from the app. The superintendent of that school, Park Grinder, says he hopes this lawsuit will encourage parents to talk about social media with their kids.
We see students, student-age people in third grade, second grade, first grade with a phone, and I don't think that's healthy. I'd like to see that stop. And so from my standpoint, parents need to be involved in what their students are doing with devices and track their individual use there in their home.
In a separate complaint, Rokita argues that the app has access to users' sensitive data, but that the app makes them believe it is safe. One cybersecurity expert says that concerns over the app are valid.
Even though the company has given assurances that there's a firewall and that things are protected, there has been some discoveries or some at least suspicions to the contrary.
Working for you, Meredith Hackler, WRTV.
And now is your chance to weigh in on this issue. Should there be an age requirement to have a TikTok account? Tell us what you think at WRTV.com/vote now. You expect life-saving care when you go to the hospital, but a new Watchdog report shows some hospitals in our area are lacking. Still to come, WRTV Investigates breaks down the report and explains how each grade was assigned. And there's a new way to stay fit during the winter months. Coming up, we'll tell you about some of the expanded programming you can take advantage of at the Greenwood Fieldhouse.
From Indy streaming news leader, this is WRTV News at 6, streaming now.
How are Indiana hospitals holding up when it comes to patient safety? A newly released report card from a medical watchdog group shows us the good and bad within 75 Indiana hospitals. WRTV Investigates Rachel Wilkerson dug through the report and found several hospitals in our area are lacking.
27 local hospitals were graded on a scale of A through F. Less than half received C's or less. A lack of trained intensive care unit doctors, poor hand washing, preventable medical errors, patient injuries, infections, and more are highlighted in this report. The letter grades come from the Leapfrog Group, a national watchdog that combines public data from the Centers for Medicare and Medicaid Services and surveys. Vice President of the Indiana Hospital Association, Karen Kennedy, explains.
The thought process is to be more transparent on quality. I think it's important that consumers and patients and families know that this is just one quality program that's out there. There's quite others.
Riverview Health in Noblesville was given a D rating, the worst out of the 75 Indiana analyzed hospitals. Reasons include bed sores, patient falls, blood clots, blood leakage during surgery, death from serious treatable complications, infections, below average hand washing, and more. The hospital is also rated a 5 out of 100 for having specially trained doctors in the intensive care unit. A Riverview Health spokesperson tells WRTV while it appreciates the organization's dedication to improving the quality of health care, it doesn't believe this survey truly reflects the overall quality of care it provides. Here is a list of local hospitals given a C. Eskenazi Health is listed below average for staff and colon infections in patients, death from treatable serious complications, accidental cuts and tears during surgery, patients falling causing broken hips, and more. It is also given a 5 out of 100 for specially trained doctors in the ICU, the lowest score in the state, according to the report. A SCORE Community Hospital in Anderson is also given. Franciscan Health is cited below average for surgical wounds splitting open, death from serious treatable complications, kidney injury after surgery, accidental tears and cuts, blood clots, patient falls, and infections. It declined to report if the hospital has enough qualified nurses and ICU nurses.
We found that several different hospitals had below average ratings for certain things such as staph infections and different infections. Is that common?
Well, obviously, like I said, any kind of medical error or a hospital-acquired condition is one too many. And I think as you're talking to hospitals in central Indiana or throughout Indiana, they take that very, very seriously.
We asked IHA what's causing these low scores, especially when it comes to staffing in the ICU.
There's been a lot of turnover. So, for instance, recently there has been a lot of turnover in infection preventionists and control, those type of professionals. You know, our healthcare workers right now, they are very stretched thin. Hospital capacities right now are high. So yes, that could certainly be one of those reasons. It also could be, I believe that component actually falls into the self-assessment component of that Leapfrog survey that hospitals complete on their own.
Most hospitals declined an interview and referred us to the Indiana Patient Safety Coalition. Kennedy says the association evaluates the reports and holds hospitals accountable.
It's very important, you know, we don't cut corners, especially when it comes to patient safety and reducing harm.
She asks you do the same.
For instance, if a healthcare provider comes in and you notice that they're in a hurry and they forgot to do good hand hygiene, speak up.
WRTV investigates. Rachel Wilkerson.
And here's a list now of the hospitals in the Indianapolis area that received an A grade. The full report can be found on our website, WRTV.com. Kevin is back with us now. Kevin, you're looking ahead now to next week, and does it include any sunshine?
Not a lot. So, you know, we get in these patterns where it's cloudy and we've had a few showers and that. So you start looking at the big picture and say, when are we going to see a change? And next week, a storm system pops up that'll be worth noting. It may spread some heavy snow out in the plain states into the northern Great Lakes. We'll be on the mild side the way it looks now, which means we may have periods of some heavy rainfall potential and even some thunderstorms. That would be Wednesday. We'll keep our eye on that in the middle of next week. Right now, it's all light rain, and most of us are not getting that. To the east, between Muncie and Richmond, Newcastle, that's where the showers continue to move to the east into the Buckeye State. We'll be left with the clouds and the drizzle and some patchy fog. Temperatures just consistently in the 40s.